The nervous system. 1. A. Sensory loss. The central nervous system controls the sensory and motor function of the body. Disease of this system therefore lead to loss of some of these functions. Function loss. Other symptoms. Function: hearing, sight, sensation, balance. Loss: deafness, blindness, numbness, unsteadiness. Other symptoms: buzzing or ringing on the ear, double vision, blurring, tingling or pins and needles, dizziness. B. Motor loss. Motor loss symptoms and signs include weakness, loss of power, paralysis, complete loss of power, tremor, involuntary rhythmic movement, especially of the hand, abnormal gait, unusual manner to waking. Speech may also be affected, for example, with hoarseness, a rough deep voice, in, in vocal cord paralysis. Slurred speech means poor articulation, as in cerebral disease. C. Loss of consciousness. Patients may describe sudden loss of consciousness in a number of ways. I pass out. I have blacked out. I fainted. I have fit. I censored. I had a convulsion. Fit, seizure, and convulsion are used to refer to violent involuntary movement as in epilepsy. Doctors may say, "When do you lose consciousness?" Here is a passage from a textbook on, on the causes of loss of consciousness. The principal differential diagnosis is between an epileptic fit and a syncopal attack, or fainting. Syncope is a sudden loss of consciousness due to a temporary failure of the cerebral circulation. Syncope is distinguished from a seizure principally by the circumstances in which the event occurs. For example, syncope usually occurs with, standing under situation of severe stress or in association with a arrhythmia, sometimes in a convulsion and urinary incontinence, loss of control of the bladder, occur even in a syncopal attack. Thus, neither of these is specific for an epileptic attack. The key is to establish the persistence or absence of prodromal symptoms, or symptoms that occur immediately before the attack. Syncopal episodes are usually preceded by symptoms of dizziness and lightheadedness. In epilepsy, people may get warning known as aria. That attack is going to happen. The nervous system. 2. A. The motor system. Examination of the motor system should include assessment of the following: muscle bulk, amount of muscle tissue. Look for signs of wasting, muscle atrophy, muscle tone, amount of tension in a muscle when it is relaxed. Tone can be increased or decreased. Muscle power, stretch, coordination, the ability to use several muscles at the same time to perform complex actions. Gait, the manner of walking. Reflex, CV below. Involuntary movements, for example, a tick or tremor. Here is an extract from a case report about the patient with a tremor. Case 80. On examination, her face showed little or no expression. There was tremor affecting mainly her right hand. She had generally increased muscle tone, power reflex, coordination, and sensation were within normal limits. Examination of the gait showed that she was slow to start walking and had difficulty stopping and turning. B. Tendon reflexes. Examination of the nervous system normally includes testing the tendon reflexes. For example, the knee jerks with a tendon hammer, also known as a reflex hammer. The reflex might absent, distant, normal, or brisk. The plantar reflex are also checked. The normal plantar response is a downwind movement plantar reflection of the big toe in going to a station or banging kiss response is abnormal. C. Coma. Coma is unconsciousness with a reduced response of external stimuli. Doctor says the patient is in a coma. The patient is in a comatose. The Glasgow Coma Scales (GCS) score that calculate as follows: eyes opening, spontaneous, to speech, to pain, no, verbal response, oriented, confused, inappropriate, incomprehensible, none. Motor response, obese, localizes, withdrawals, flexion, station, none. Unit 28, Oncology. New plants. A new plant is a normal new growth of tissue. Malplant, neoplants, cancer are likely to spread and cause serious illness or death. Benign neoplants do not spread and are less harmful. When speaking to patients, doctors generally say growth of tumor. You have a small tumor in the bowel. You had a small growth in the bowel. A lump is swelling is a collection of tissue or fluid which is invisible or palpable. Can be palpated or felt with a finger. Lump may be due to an outplus but there are other causes such as inflammation or fluid accumulation. Patient says, I have a lump in my left breast. Doctor says, there was a firm, palpable mass in the liver. Unit 28, the oncology. Neoplasm. Unit 28, oncology. A. Neoplasm. A neoplasm is an abnormal new growth of tissue. Malignant neoplasms, cancer, are likely to spread and cause serious illness or death. These neoplasms do not spread and are less harmful. When speaking to patients, doctor generally says, growth or tumor. You have a small tumor in the bowel. You have a small growth in bowel. A lump or swelling is a collection of tissue fluid which is visible or palpable. Can be palpated or felt with a finger. A lump may be due to a neoplasm, but there is other causes such as inflammation or fluid accumulation. Patient says, I have a lump in my left breast. Doctor says, there was a firm, palpable mass in the liver. Malignant tumors are characterized by rapid growth in invasiveness. The tumor may invade local tissues or may spread to distant parts of the body. Metastasis. Neoplasms, which are the result of metastasis, are called secondary, as opposite to the original tumor, which is the primary. We have the result of the scan back now, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be at an early stage, and there is no sign of spread. So if we remove it, there is every chance of complete cure. Note: in B. Symptoms and signs of malignancy. The symptoms of malignant disease may be related to the size of the location of the tumor. For example, a space-occupying lesion in the brain causes raised intracranial pressure and symptoms such as headache, vomiting, or usual disturbance. Tumors of the colon made of throat. The lumen and the case change in the bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 55. A 30-year-old man presented to his GP complaining of painless lump on the right side of his neck, which has present of about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 kilos in weight. He is also complaining of night sweats. He has no significant past medical history. C. Treatment of tumors. A tumor can sometimes be completely removed of its size by surgery. If this is not possible, for example, if it is already metastasized to other parts of the body, it may be possible to destroy by radiotherapy or by chemotherapy. When a cure is not possible, palliative treatment is given, which is only instead to relieve the symptoms. Unit 29. Pregnancy and Childbirth. Childbirth, the expected date of delivery, EDD, is the day on which a woman is expected to give birth to the child she carried pregnant with. It is calculated by adding 280 days or 40 weeks and the first date of the last menstrual period, LMP. Childbirth is also referred to the doctors as peritoneum, delivered in the process of helping the clinical to be reborn. A spontaneous vaginal delivery, SVD, is normal delivery. If there are complications, the baby may be delivered by caesarean section. A full-term pregnancy is 40 weeks, divided into the 3 trimesters. A baby who is born before this is premature, and one born after 40 weeks is postmature. A baby who is born dead, for example, because an umbilical cord is around his neck, is a stillborn. A pregnancy may be end before term spontaneously with the miscarriage, or be deliberate terminate with an indicated abortion. B. Labor. The process by which the fetus and placentas are pushed out of the uterus is called labor. It is divided into 4 stages. Some words which are combined with labors are premature, prolonged, spontaneous, indecisive, false labor. C. Presentation and light. Fetal light is the position of the fetus in the uterus. The normal is longitudinal and the abnormal is the transversal fetal. Unit 30. The respiratory system. Cough. It is a common symptom of upper respiratory tract infection, URTI, and lung disease. A cough may be productive where the patient coughs up a sputum, or non-productive where there is no sputum. A productive cough is often described as loose and yellow due to the presence of pus, purulent, or blood stained, as in hemophysis. Doctor writes in the patient's case notes, CO dysphonia and cough, C purulent sputum for years, no hemoptysis. B. Auscultation. The doctor is examining Mr. Hamilton's chest. Take deep breath in and out through your mouth. Good. Now say 99. Listen to the chest with the stethoscope may reveal the presence of sounds apart of the normal breath sounds. There are two main kinds of other sounds: crackles, crackles, which sounds like hair being rubbed together and suggest the presence of fluid in the lungs. Whishes, with are more musical sounds like whistling, and indicate narrowing of the airways. The sounds of mouth pressure. Breathing is also called whistling. The sounds are when the pleural surface are inflamed, as a pleurisy is called pleural rub. The doctor asked Mr. Hamilton to say 1999 to check vocal resonance, which might be increased or decreased. After examining Mr. Hamilton, the doctors asked to his nose. OE chest, early inspiratory crackles, both long bases, expiratory wheeze. Unit 31. The skin. 1. Some types of skin lesion. Medical term. Common word and features. Medical term. Macular. Macule. Spot not raised above the surface of the skin. Papulate. Spot raised above the surface of the skin. Nodule. Long. A large papule. Vesicle. Small blister filled with fluid. Buoy. Blister test. A large vesicle. Crust. Scab. Dye blood, etc. on the surface of the skin. Cicatrice. Scar. A mark on the skin after healing. Navius. Birthmark. A colored skin lesion present at birth. Leachy nervous. Mole. A rising burn nervous. Baraka. Wart. Another produced by HPV. Furuncle. Boil. A large pustule or skin abscess. B. Rashes. A single skin lesion can be regular or irregular in shape. When there are many lesions, especially macules or papules, the result is a rash. For example, the rash of an infectious disease such as rubella as rash is said at a rub or breakout. My little boy has broken out in spots all over his body. My little boy has broken out in a rash all over his body. The following features of skin lesions are usually noted: location, size, shape, color, type. For a rash, note also distribution and grouping. The skin 2. Injuries to the skin. Medical injuries of the skin are divided into those caused by a blunt force, such as points from a first, and those caused by the scar force, such as a knife. Injuries from blunt force and abrasions, also called a graze or scratch, is a superficial injury involving the epidermis, which has been removed with friction. A scratch is linear as an fingernail. Scratches, where a graze involves a withered area as an abrasion caused by dragging part of the body over the raw surface. A contusion is an injury that occurs when blood vessels. B. Case report. Read the case report and compare it with the illustration. Case 2. A. A 9-year-old boy presented to the accident with an emergency department after he stumbled and fell while running in the hood. He had received a blow in the head from the rock and had been scratched by brushes. On examination, a vertical laceration 1 centimeter long was noted on the bridge of his nose, just right of the middle of the mid-dial. There were a number of superficial scratches, and on the right side of the forehead, his right upper limb was mildly contused. C. Sores. The word sores is a popular term for many different types of skin lesions, especially infected lesions. A pressure sore is a skin ulcer caused by pressure. For example, the pressure of lying in the bed of long periods, also known as a bed sore or the cubit ulcer. A cold sore is a lesion caused by herpes simplex. Unit 33. The urinary system. A. Urinary symptoms. Urinary is formed in the kidneys and stored in the bladder until it passed. Patient may say, I have some pain when I pass water. I have some pain when I pee. Doctors may say, are you having any trouble when your water works? Common urinary symptoms and their definition. Frequency. Frequent passing urine. Dysuria. Burning or scalping pain in the urethra when passing urine. Nocturia. Urination at night. Urgency. Urgent need to pass your urine. Hesitancy. Difficulty starting to pass urine. Urinary incontinence. Involuntary passing of urine. Hematuria. Macroscopic blood in the urine. B. Urine analysis. Urinalysis is the analysis of urine. Simple screen tests of the urine are carried out with agent script. For example, chemistries of the detection of glucose. More detailed tests are carried are carried out in laboratory of a specimen of urine. Typical specimens are mid-string specimen MSU and a culture specimen CSU. Microscopy examination may reveal the presence of red blood cells, poop cells, or cast. Cats are solid blood bodies formed for protein cells. Blood signs are used in case notes to indicate abnormal findings. A small amount is described as a trace. For a large amount, the words gross or market can be used, for example, gross hematuria. When there is nothing, the word new is common. Sugar new, protein plus blood plus plus plus. There was no sugar, a trace of protein, and gross hematuria. Unit 34. Basic investigation. Ophthalmoscopy. An ophthalmoscopy allowed the doctor to examine all parts of the eye, the iris, lens, retina, and optic discs. For example, result the examination is done with dimmed or lowered light to allow the pupil to maximally dilate or widen. A topical mydriatic solution may apply to the eye dilatation. The patient is then asked fixate on the target for the duration of a test. Blood pressure, cyanometer, goggle, earpiece, stethoscope, earpiece, bell, diaphragm, scope, pump, valve. An stethoscope is used to hear the sound of a blood rushing back through the artery. The first thumping sound is the systolic blood pressure, SBP. When the thumping sound is no longer heard, that is the diastolic blood pressure, DBP. C. Taking blood pressure. During vein puncture, the phlebotomist, the technician who carries blood, insert a needle into the vein and withdraws with blood into an specimen tube, which is sent to the hematology laboratory for analysis. Usually, the problem can find a vein in the inner part of the elbow. The antevertebral fossa that is easily accessible, she may apply to tourniquet a tight band above the side, or the patient may be asked to clench their hand to make a first in order to make the vein more poignant. Afterwards, the patient may be asked to press light on the dressing, usually a piece of gauze, to help the blood to clot and to prevent swelling and a hematoma where the vein was punctured.